Hi, I'm Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today, we're discussing natural killer cell therapy. I'm here with one of our top physicians at our Tijuana, Mexico clinic, Dr. Oscar. How are you doing today?
I'm doing good. How are you?
Excellent, thank you. So I want to talk about the process for a moment.
Sure.
We always start with a free consultation. We do that globally. But for the Natural Killer Cell program, which is here in Tijuana, same process. We do a free consultation, and then our patient concierge representatives will work with the patient to help retrieve any medical records. Because our doctors need to look and see, A, is he or she a candidate? B, if the answer is yes, then it comes down to how many natural killer cells are going to be. But talk to me about the process once the patient gets here. How do you go through the various treatment protocols?
We take a look to all the vital signs to make sure they are ready to do the therapy and they're not having any kind of issue right there. So once the patient is safe, and we make sure the patient is safe, we start with an IV, and we put the NK cells right through the IV. We also put some vitamins through the IV, vitamin C. So there's a lot of research that, and a lot of places that treat cancer with vitamin C. So once we put the NK cells, we wait a little bit, maybe about half an hour or an hour, and then we check all the vital signs to the patient once again, make sure they're doing fine during the procedure. And once we finish the procedure, we take out the IV, we ask them follow-up questions, how are they feeling, do they have any kind of reactions, and take their vital signs once again, just to make sure they don't have any kind of reaction to that. It's normal to have a little bit of headache, a little bit of fever, but it's normal during these kind of cellular therapies.
And I know what we've done is the Monday, Wednesday, Friday type of cellular therapy, giving them a day in between, where we typically will do monoclonal antibodies therapy as well. There are specialty applications we talked about, such as intrathecal, if someone has a central nervous system malignancy, or if they have something like you mentioned, the prostate would be an in situ. Some of those we can do here in the clinic. We have the monitoring, the conscious sedation. However, we have the surgery center right across the street.
Right across the street, so we don't have a big issue if the patient needs that special kind of treatment. We only take him across the street, and we have the OR ready to them.
Yeah.
In a best case scenario, 3 times a week, and he repeats the treatment maybe 3 months later or 6 months later.